the EDSS scores, which are extremely crude, virtually didn't change. Now, people want evidence-based medicine, and they want us to show that the EDSS changes. Well, you can't have your cake and eat it too, folks. After 10 years of using the CRAB drugs, and any of you with it know that that's Copaxone, Rebif, Avonex, and Beta-Seron, the 10-year data on CRAB drugs shows it doesn't change the EDSS one iota either. They do maybe reduce the number of lesions found in the brain, but your long-term outcome isn't changed one bit. So I would suggest some of my colleagues are skating on thin ice when they want a whole raft of evidence based on this one. If they're going to be as aggressive about evidence-based medicine, then we have to throw those four suckers out. They did have one redeeming feature at the meeting. They suggested that the interferons may reduce the problem in blood-brain barrier breakdown. I think the jury's a bit out on that, and I think that's a very smart compromise that some people have suggested. Okay, so that takes us to it. That gives us a bit of more time for question. I think I've given you very much my personal opinions, but I've also tried to give you what's out there and what's in the literature and what's starting to show up in the data. Most of those will be published over the next little while. Back to you.
Okay, thank you very much, Bill. That was... Now, it's approaching 9:30. I'd like just to bring that to the attention of anybody who might be looking for a handy dart. So you can please make your way out. I think we can keep this room for past our 9:30 time, and don't feel shy, however, about moving on out whenever you have to go. So having said that, I'd like to go back to open the floor up for some more questions. And right, I think you got one.
Bill?
Yes.
Just had a question. We've got all these studies happening like down in the States, like you mentioned before. What's wrong with Canada? I mean, why are we having to reinvent the wheel here? That's my question.
Well, do you want what I feel or what?
I don't care. Go for what you want.
It's extremely frustrating. We have some very good, bright researchers in Canada. We were stymied right at the get-go because whenever anybody talked about this, they got their hands slapped by their licensing body, their College of Physicians and Surgeons, and we did it aggressively here in BC. When you threaten to take away a doctor's license, he listens, or she listens. Why? That's their livelihood. You lose your license, you're done. You can't earn a dime. So it's been fear-mongering by a small core of people, and they've had enough people listen to them. The medical hierarchy has been huge in this country. I didn't know it was so bad. I've learned it the hard way this time. But we need to move forward. We need to help the neurologists realize they're not the only person that can look after us, that we're also thinking beings. There's other people that care about our brain's function. It might be neurophysiologists, it might be neurosurgeons, it might be interventional radiologists, it may be anesthesiologists, but we need to get more people at the table than just a small core group which have been selected otherwise. There is people who want to research it. There is quite a bit of research happening in Saskatchewan because they've got a lot of money for it. Saskatchewan has the highest amount of MS in Canada, and they dream of making themselves the niche study focus for MS. One of the good things is their MS clinic is run by a rehabilitation medicine specialist, but she's a young woman, she's smart, but she's very conservative. She doesn't want to tick off her neurologist colleague, and we've got some of our most conservative ones there, sadly. So I'm hoping that all changes. They're about to appoint a new clinical chair. They just got a brilliant fellow as a new basic science chair. So that's two brand new chairs. They pay these people pretty well and give them decent research money to do. They've also got the synchrotron there, which may be a very valuable piece in study of iron, because it allows the study of different pieces of metal. So why? Well, most people have had the brakes put on them. It's almost been let loose. It could happen first in BC. I got a hunch it might happen first in the prairies, Saskatchewan, Manitoba, although Alberta's starting to rumble. And Ontario, well, not that Sandy MacDonald hasn't tried huge, and Kirsty Duncan hasn't tried huge, and Mark Hakey hasn't tried, although he's mostly focused on the Wayne State side of the border. But it's edging forward. I'm a little disappointed. We talked lots about the studies that are in progress funded by the MS Society, but we have to realize those are correlation studies. We're only reinventing the wheel to decide if people with MS have CCSVI more commonly than others. I didn't address it directly. 1,000 patients with MS in Poland under venous angiography, injection of dye, and looking at it under X-ray, 97% had CCSVI. And the numbers are anywhere from 86 to 97% in about 8 countries in the world in large numbers. 450 patients, 600 patients, 100 patients in Britain. So, when we get those studies all done in about 2 years, the most we'll have is data to support the studies that have already been done. And Canadians, sure, we're unique, but we're not that different. So it's going to take some pressure from us. It's going to take ongoing. This is one that's going to be won by the people. We've already seen the changes. It was mentioned in the February 11th Scientific American. Social media, i.e. Facebook and a bit Twitter, have changed medicine practice, and the example of that is CCSVI. Sure, they grumble in it that they're not sure if it's a good idea or not. Since then, we've seen it change countries. It changed Egypt, it changed Tunisia, and maybe without the tsunami and everything else, it might have changed Libya. But, it's time for us to band together. I applaud the MS Society, and I'm really proud of our National CCSVI Society. And if you folks are interested, let us know. But, we've got to work together to change this ball of wax, to get over this polarization which was set up at the front unnecessarily, but we can't change what happened yesterday. We can only move forward as a team. Pull together. Criticism doesn't work, okay? Working together as a team does.
Thanks, Phil. Pippa, could you...
Actually, I forgot what my question is now. Am I switched on? Yes, I am. Just a question. The procedures seem to have changed a little bit in Seattle and Newport from perhaps what the panel were talking about. And I'm just wondering what the difference is.
Well, one of the biggest changes is Newport was the very first area in North America to adopt the large balloons for treatment of the valves. And I'll give them full credit for that. They started it in October, all right? And some of them haven't changed yet for any number of reasons, but they haven't gone to the larger balloons in some centers. The one thing that makes me reluctant, I'm still worried about people. It's great, it's best to have really good diagnosis of what your vein structure is like before you have it. I think Dr. McGuckin is a good vascular surgeon. I met him in Italy. I'll give him credit, he went. But he only goes direct on what he finds on the vein study.